Hi, it's Kim Drucker Stockwell with Women's Survival Guide, and today have I got a treat for you. This is Dr. Heather Bartos, and she's coming to us live from Texas, but
Yeah.
she's kind of global, I think. And we are going to talk about some serious stuff today. We are going to talk about, she is a menopause specialist, an OBGYN, menopause specialist, and all the other stuff you've done. You were in the Navy, you were in PRA, some kind of Marine thing thrown in there. But
Yeah.
but for my group, the most important thing is the down, not so much dirty, but of menopause, like from pre-peri to menopause to after, um, and talking about stuff that is sort of embarrassing to some people. So just prepare yourself that you may get a little squeamish on this. But how much worse can it be than having your period all the time? So, Dr. Bartos, thank you for joining me.
Thank you. And we're actually filming this on World Menopause Day. So it's kind of,
Is it really?
yeah, so it's very kismety, if
I
that's a
mean,
word.
of
Like
course we
that.
are. I planned that.
You did. You did. You don't remember that you did because that's a sign of menopause, but you did.
I was at a tea yesterday. I actually went to tea. Yes, I am in Boston.
Oh,
I did. I went to a formal tea, high tea, with a friend of mine, two friends, and it was the funniest thing. And sitting next to us was a table of another unrelated, but they happened to be three women I knew next to me, and trying to finish a sentence. And this was at 3 o'clock in the afternoon. It's not like it was night or anything. I don't think any of us, the three of us, could finish a sentence without going, I mean, you know what we're doing. I mean, I'd seem to do okay on these interviews, but good Lord, put me in a I couldn't think of a word, but neither could the other two women with me. And then they would be like, give me a little something. Oh, I know what that is. That's that. Like, you mean that movie that came out with the 14-year-old who got married and it's like down south, oh, I know what that is. And it is a thing. Yeah.
it's a thing. It's a
Yeah.
real thing. And we used to think it was a permanent change that at menopause we had a cognitive decline. And there was gifs and memes back in the day. I mean, our
Yeah.
grandmothers and mothers' days.
Mm.
And now we know it's really just a temporary flux. And we do it when we're pregnant. We kind of get pregnancy brain, we call it. And we probably do it at puberty too, but none of us remember it because thank God we don't remember it. So
Oh,
it's a really common thing is our hormones shift that we're kind of like, wait, what's going on? Where am I? What is this called?
huh.
And so we just kind of all laugh about it and we kind of say, oh, we help each other out as sisters.
Yeah. We were
It's a
totally
it's
doing
a real thing and it's normal. It's not dementia or Alzheimer's,
that.
starting at 50 something. It's just the brain's shifting because the hormones are shifting.
Wait, this is like a news flash. So wait, it's temporary?
Yeah, so as the hormones are going down, so estrogen being the big one, and there's
Hmm.
estrogen receptors throughout your entire body, like everywhere, your brain, your bones, like everything. And so as those estrogen receptors are going down, they're like, what's going on? Why do we not have our hormones?
Hmm.
And so we can start forgetting a little something here and there. Usually it's a word thing where you're like, this this thing and you know what it is you're like innerly I know it's a cup but it doesn't come out. And so I always tell when I'm like, so what you do is you start describing it, this thing that I pour my coffee
That's what
into
I
it.
do.
And so because if we start panicking, we'll never know it because we're like, oh crap, like I'm in this meeting or whatever. I don't know what the word is. So then you start panicking. Well, then you have cortisol and you have epinephrine. So you're not going to know it, right? You're in fight or flight at that moment. So I was like, just describe it. This thing, and it's very dramatic and it's very
Mhm.
kind of, like Kathy Bates and Matlock, right? It's very like
Yeah.
this thing, this device that we use. And people go, wow, she's really good at presenting. And you're like, I have no fucking clue what the word is, but I'm gonna work it.
That is so, but they wait, in case we missed it, that was like a serious tip. That was like a helpful tip. And it is kind of what we were doing yesterday We couldn't
Yeah.
think of something, and it would be something like a cup, like it would be
Some,
like a pin or an earring
yeah,
or whatever it was we were talking about, and that was it. It's like the thing you put in your ear, like, oh
yeah,
yeah. And
yeah.
not for a second did any of us think, oh my God, you dumb broad. It was always like, in a way, I will say that I think this is a really interesting and wonderful period of time, but it needs to be managed in a realistic way. It needs to be thought through. And I think one of the things that I'm gonna shut up in a minute and let you roll, but I think no, it's just there. If you think you're a crazy mood swing lunatic, then you got to do something about it. And it could be a number of things. It could be maybe you need a little SSRI, maybe you're drinking too much, maybe you're eating too much sugar, maybe you're not exercising enough. We know if you're around our age, if you're between like
Yeah.
35 and up, um, these are things, but it's up, but you still need to do something. No one else is going to do it for you, and your body isn't doing it for you. So you got to take control. So I think the one thing that I would love for people to do is to listen to you, and like that was a helpful tip, and it's an actual tip. Don't
Mm.
out. It's not embarrassing. And I love the idea of Matt, the new Matlock, Katie Bates, like being, because that is, you can visualize her being like, I am not stupid. This thing that I put water in, you're stupid. What do you think I'm talking about? And they're like, a cup. You're like, exactly, a cup.
Like,
Like, yes, it was a cup. It was a cup.
it was
So
a kind
yeah, so it could be anything, and it could be like if you're having issues like anything in life, you've got to do something about it. And if you don't know what to do, then you've got to get off your butt and look. And that's kind of what it is we're trying to do with Women's Survival Guide is help me help you. Like here's a lot of ideas if you're sad because everyone's left the nest or your job is you've retired or you're sad because you're fat and crazy or whatever, but no one can help you but you. And so I know people have a lot of questions, but I also know that this is what you do for a living now. You don't do OBGYN anymore. And and maybe we just start from there and we like skip your early life because that's really cool. But we're
that
we're
was
here.
boring.
We're in
That
the
old,
cool,
that young
we're
stuff was boring.
we're in menopause, baby. I'm gonna get a
Uh,
jacket.
we're part of the M club now, right?
Exactly. So tell me about why did you end up from being an OBGYN into being a menopause specialist?
Yeah, I've delivered, I think I counted one time, and I'm close to like 5,000 deliveries,
Wow.
babies over 20 years.
Hmm.
And I started to realize I was the age of some of the grandmothers that
Oh
were
my
there.
God.
I mean, the
That's scary.
grandmothers, like the great grandmothers, like the grandmothers of the patients. I had one of those one time and I was like, holy shit. And
Oh,
I
grim.
just couldn't, I felt so bad when I would look in the waiting room and I would see women that were 40, 45, and they were sitting there with a well, and during COVID, there was no magazines, right? Because you couldn't have magazines. So they were sitting there and there was like, and then I'd have to run out and go to a delivery. And then I'd run back. And I was going as fast
Oh,
as I could. And they were just like, I'll just wait. No one
oh,
cares about me.
no one
When
cares.
I know, and I went to like my first mammogram. I think I was 40, and I looked around and go, damn, I feel good. I'm like the
Right.
youngest from this room again. Like that hadn't happened for so long. And I realized that that was a whole neglected section of women. I mean, we take care of women's health, women's life. Well, by 40, we're only maybe halfway through, if not less. So like,
Yeah,
what's wrong? What are we doing with these women up here?
right.
And when you deliver babies, you can't focus on those women because it
Hmm.
is life or death. Go now, go now.
Right.
And so I gave up OB first. That was the first thing I gave up, which meant I got to sleep because at 50, shit, girl, I couldn't be up at 2 or 3 in the morning and then be a nice human being the next day, let alone function with what the words were. And so I gave up OB first and really just kind of focused on women 40 plus, 35, 40 plus. And then I gave up surgery the past year because I really was like, I just want to focus on women's health.
Yeah.
While I liked doing surgery, it wasn't fulfilling for me. Like, oh, cut your uterus. I mean, really, there's a lot of doctors that can do that. But I
Yeah.
was kind of like, how do we manage the health? Like the mindset, the mind changes, like really midlife healthcare.
Mhm.
And so I stopped doing surgery. I think it was, oh, was it this year? Early this year? I don't know. It's,
I
you know,
know. Who
time.
knows? It's all a
I don't know.
mystery.
At some point I gave it up. And so now I really just focus on the kind of, as I like to say, we focus on the whole woman, not just a woman's whole.
That's a good one.
And that's the difference between women and male
There are
doctors is
three though.
we focus on everything.
Three holes.
The three holes. Yes, there are three holes down below. Um, and because there weren't women that were getting, they go to their PCP and they were like, well, you're depressed. Here's
Right.
an SSRI. But they were also 50 and they were also having a hot flash. So then we were kind of almost patchworking together medical care
It's
and
very patchwork. Yeah.
no one was talking to each other. And so I kind of started doing that for kind of the whole thing because women needed some person to just kind of doula, Sherpa, whatever I can
It
say
is
these.
like a doula in a way.
It's like a doula. So
Yeah.
like I would take over like the depression and anxiety, and I would take over. I mean, obviously, if there was a huge mental health problem, I would enlist the help of a psychiatrist. But good luck finding a psychiatrist these days since COVID. Like they're
Right.
nowhere to be
Or an
found.
older person, like, do you really want to see a 30-year-old as
Yeah,
50 something?
yep.
I don't know if that's really like apples to apples, you know?
I think it's kind of like you gotta be in the club to know how to get someone into the club. I mean, differently than, obviously men can deliver babies, it's great, but I'd had women that were going and they were like, oh, here's just a bunch of testosterone. And I'm like, oh Lord, men, what do they, they don't understand. They haven't been in the body to know what a
Right.
hot flash feels like and how you get the palpitations and the anxiety when that's happening, or the vaginal dryness or the joint pain. That was, the main reason I started hormones was my joints just hurt. The hair thinning, all the different things, the zaps in your skin, like all these things the
You
guys didn't understand. It's in a
know,
book,
it's pretty
but they're,
weird.
yeah,
Yeah.
they're weird until someone goes, well, I had these zaps. I'm like, yeah, I've had the zaps. I know mine are right here in my head, my scalp. And they're like,
Have those.
no. I'm like, yeah, I know, girl, I had it all.
Well, I think
As
one of the things that you're talking about, it's so interesting because like half of the things you listed I've had and have, and like a bunch of those I've not had.
yeah,
And I think while I was writing up the questions that I was taking and then like trying to remember and whatever, I mean, there's some that I have and some that I don't. And if I don't, I don't think about them because I don't have them.
yeah,
So you said to me when we first talked, a month or two ago, there are 33 um, signs or 33
yeah,
symptoms of menopause. And that to me is a showstopper, like 33. And I've never had joint pain. And you were talking about that at the time, and it makes perfect sense. I mean, like my husband's hands really hurt right now, but my mom's hands are like really, really hurt. So my husband definitely doesn't have menopause. But it's like when you think of like the creeping old lady or whatever, like I don't have joint pain, but you said that put you on HRT, and then we should talk about, I'm sure you have a list somewhere of the 33 different symptoms so that women, it's almost like this gaslighting effect that they're like, wait, I'm this age. I don't remember having this. Did I have this? And her doctor is going to be like, "Oh, you're just getting older." But no, it's as a result of menopause and the estrogen changes and the changes in the hormones in your body, and that
yeah.
actually can be dealt with. So tell me about the joint pain thing and then into the 33 things.
Yeah, so it's interesting. First of all, only 4 out of 5 women get hot flashes. Like the dentists, right? Like the four out
Yeah.
of five dentists agree that cocaine is great. So,
I
we're led to believe that hot flashes is what you're going to get.
Yeah.
But really that means 20% of us are
Yeah.
not going to get hot flashes, or at least appreciable ones that we're going to like seek medical care for.
Hmm.
And so, so women are like, oh, well, I don't have I must not be in menopause, or I don't have
That
symptoms. But
makes
then
sense.
we start going through the list, they
Yeah.
go, I have that, I have
Right.
that, I have that.
Hmm.
And those are recognized symptoms. I'm convinced there's probably another 20 to maybe more that aren't even recognized by the Menopause Society.
Oh,
Uh, but the big one for me was this joint pain.
yeah.
And I'm not like I don't look like I was a former gymnast or athlete. I was not. But it was like this pervasive joint pain. And I realized I was like, there's estrogen receptors in our joints. And so if my
Okay.
estrogen is declining, that's where it's hitting me.
Yeah.
And this was my baby delivering shoulder. I'd reach in and
Oh,
babies. And so I realized I probably have a little arthritis in my
wow.
shoulder.
Yeah.
And and then on top of that, I don't have any estrogen. So for me, that was the big reason that I started estrogen. I had
Okay.
the other ones before, but I was holding out on estrogen until I felt like I really needed it. And I didn't have a lot, unless I was drinking alcohol, which I don't drink anymore because I would get like the flush and I
Yeah.
Zoom call. And also I'm like, oh, here it comes, my Zoom hot flash like every time. And so I was like, let me see if this estrogen helps the joint pain. And it did, like, significantly. If I don't take it, I'm like, oh, I feel like my rheumatism is acting up, and that's what
So,
women will talk about.
so let me back up a second. We'll just use you as the guinea pig right now. So you before the estrogen, you said you were on some other things before, and why
Yes.
and how did you get into that?
My first hormone that I personally went on was testosterone.
Okay.
Um, I'd
What
had low
would go
testosterone.
on? Why would one go on that?
So I say that testosterone is what makes Channing Tatum Channing Tatum. Like it is muscle, it's
Oh.
energy, it's Magic Mike, it's vitality, right? And there's a sex drive component to it too.
Mm-hmm.
And when I tested myself, my testosterone was always really low. And I was like, hey, I need to build muscle because my muscle, you lose muscle rapidly at
Oh,
age 40. And so I
God.
was like, I was working out. I wasn't like seeing anything. It was all flabby still. So I started testosterone, low dose testosterone first. And then once I stopped delivering babies, I realized I couldn't sleep at night. I would wake up every morning at 2 a.m., the witching hour. And
Yes.
so I started progesterone then next. So progesterone is great for sleeping and for calmness and anxiety and everything.
Wow.
And so I started that next. And then I was holding out on the estrogen as long as I could. And then I was like, let me see if this
But
fixes.
why? Why were you holding out on the
Um,
estrogen?
because then I was like, then I was actually menopausal, and I was like trying, I was like holding on to the door. No, I'm not menopausal yet. No,
Yeah.
and then finally I was like, oh fuck it, let's just treat this, and my estrogen levels looked good on labs, so I was really then treating symptoms, not lab levels, which is what
Okay.
I that we do at late perimenopause.
Mm-hmm.
uh, we treat the symptoms. We don't just treat numbers, but my numbers, I was like, oh, I don't want to give myself too much estrogen because then you get kind of overweight and you get bitchier. And I was like, I don't need that. So that's why I waited until the end. So I kind of added them in a stepwise fashion, but every woman is so different. Like sometimes we
Yeah.
add we don't add testosterone at all. I've had women, yesterday, I didn't add testosterone on any of them yesterday because their numbers were still good. So
Huh.
it really comes down to symptoms and labs.
How often do you have to, like, of your patients, like you were saying, you didn't give any of them testosterone. How often would you need to look at those numbers and jigger them?
The first year, I usually will see people like every 3 months
Okay.
because we're adjusting and tweaking.
Hmm.
I always start everyone on the lowest dose that we need, like the lowest, like
Yeah.
bare bottom. And then I'll usually see how we're feeling at the 3 month mark. Now at that point, now the testosterone may be needed, or they're like, you know what, I feel so much better, but now I realize I have no sex drive. So now
Oh,
I feel like this. So sometimes when we take off like the big ones, all of a sudden the little ones kind of pop up. And
yeah.
so usually the first year we'll see you every 3 months. Now testosterone is interesting because the patriarchy believes we don't need it. And so there's no FDA approved testosterone for women at all.
Got it.
So Menopause Society says, oh, that's okay. Just get the men's gel and try to use 1/10 of the package. Now, I've seen
What?
these. It's like a sugar like
What? What does that
like it.
even mean?
this out. Like that's not even feasible. And it's not usually covered and it's just messy. And so usually we compound testosterone for women. We do it in creams or troches or under the tongue tablets, but it's
Oh,
a controlled substance. So we have to see you every 3 months if we're going to do
okay.
testosterone.
Can it be on Zoom as well?
Yep,
Like, does
we
it
can
have
do
to
it.
be
We
in
just have to
person?
kind of see you and make sure, and then we have to write a new prescription because they won't take the old prescription after 3 months. So it's like Adderall or these kind of things. I mean, what are you going to do with a bunch of it? Turn into a guy?
No,
But
thank you. A
because
tiny little guy.
the DEA wants to get involved in my stuff, then that's what we do. Yeah, we just do a quick Zoom call and we just kind of follow up with
Okay.
that.
Yeah. God, that's just fascinating because the other thing you and I talked about, just we're just launching into the HRT stuff, is I remember I was asking my doctor about the combi patch, and and I was asking my readers about it, on and on. And you were saying how that's just not a great. Okay, so the good news is that there is a combi patch. The bad news is that it's not the right amount and dose for everyone, as we were just talking about. And the bad news is that there aren't that many people sprinkled in the women's health that specialize in hormone levels the way you do.
Yeah.
So there's only so many, and the average lady on the street isn't going to be able to get access to your specialty, but while we have you, I think I'd love to talk to the idea of combi patch versus good or bad.
Well, I always say personally, for my body, I don't love the patch. I'm a allergic white girl. Like I get, like the kind of irritated, like hive kind of things, and I itch. And then, it's Texas in the summer, we're swimming and there's pools and it's coming off. And so for me, I don't love it. Now, I have women that love the patch and there's a reason I don't really ever prescribe combi patch. And the biggest one is, I think I may have told you this, I can't remember. I talk a lot about hormones. Progesterone's good for sleep. It's nighttime. So if you have a
Right.
combi patch, you're getting progesterone all the time. And so you may feel kind of, I think, groggy on it. The other thing is it's like your car radio. I can only go up completely or down completely. I can't adjust the treble and the bass. So if you're like, I need more progesterone, I
Right.
have no to adjust that with also
Right.
upping your estrogen, which you may not want. And
Right.
so I think there's more side effects with it for that reason. So even if I do a patch for somebody, because they're like, I love the patch. And by the way, twice a week is really hard to remember. Some woman on TikTok was trying to fight me on this. And she's like, you can't remember to take something twice a week. And I was like, bitch, don't come at me. I was like, for women that have brain fog and brain fog and you're busy and you got kids at home and you've got grandkids and you're working, I'm like, twice a week is not intuitive. Like Wednesday, Saturday,
No,
but
it's
it's
not. Every day is intuitive. I
every
mean,
day. I can even go with 3 times a week because you got Monday, Wednesday, Friday. Like I get that. But like your weekends are very different than your weekdays. So I do think
totally.
it's a little bit of an odd dosing regimen. But if they want that, then I'll usually do oral micronized progesterone, which is bioidentical and it's available commercially at all the big pharmacies.
Mhm.
So I can do more of a bioidentical profile that the FDA has approved.
Yeah. So it is interesting because there's like the perimenopause menopausal cases where their symptoms are extreme and a lot. Like
Yeah.
uh and I think that those people are will go seek help for sure. But for people like, I mean, actually kind of like me, where I don't have extreme, like I'm kind of like, do I need HRT or not? And I'm not worried about like my mom's generation where there were those studies that were everyone's going to die if they take hormone replacement therapy. Like they all got cancer and died. And it's like, well, actually, it sounds like those studies were faulty. And what did they like tested people that were already old, like
Yeah.
like really old compared to what they should have been.
Well, I don't like to use the word really old anymore because we're getting close to that
Well, I
age.
mean, it was like
Um,
even in their 70s for
yeah,
something that you should have been talking to someone in their 50s. Like,
absolutely. I think their biggest flaw, and the WHI study has since been debunked. That's the study that we're talking about. It
yeah,
was
I think
I
so.
was a when I was a resident, it came out, and what they did was they started women in their mid 60s on hormones. And then
Oh,
they noticed that they had increased risks of stroke and heart attack and breast cancer. And just being 64, 65 is an increased risk of those things anyway. And so
right.
what we said was it was a timing problem. They
Okay,
misunderstood the timing of hormone therapy because we want to get women at the start of menopause, within 10 years of menopause. So we
okay,
say under 60 or in the first 10 years. So like I just went through menopause, so I could go like through 63, I could start it, but it's a risk benefit thing. So like if you're high risk for breast cancer, do we want to do that? Or do we want to do, if you're high risk for heart disease, do we want to start something when
right.
your muscles are already getting stiffer as we age? So we want to start it as soon as we can,
Mm-hmm.
but within 10 years. I mean, so that gives us quite a bit of leeway. But
Yeah.
that was the big problem with the studies. Let's just take a group of 65-year-old women and let's start them on hormones and see what happens. And they're like, wait, I'm so surprised. They're all having strokes and heart attacks. Yeah, because you really don't need them at 65. I do have women that are on hormones at 65, but they've been on them continuously since they were 45 or 50, so they've
Okay.
never gone off of them. And so I have women, in fact, a really good friend of mine is Dr. Mary Jane Menken, who's at Yale, and she's kind of the godmother of menopause. And she's,
That's
she's
a
70,
title.
I know, right? She's 72. And we were at the Menopause Society meeting together, and I said, and I joked, because here's what you know about me is I broke into the Menopause Society meeting this year. They were sold out, and I already had a ticket and a hotel room. So I broke in. That's what kind of rebel I am. I broke into the Menopause Society meeting. And so I told her, I said, if they take me out in an orange jumpsuit and chains, please make sure I get my hormones because I can't live without them. And she said, they'll have to take my hormones out of my cold, dead hands. So here's the 72, a menopause specialist, and she's going to stay on them as long as she can because we
Yeah.
want to keep women active and working. So like if you're retired and you're gardening all day, like Ina Garden or something beautiful like that, you may not need them forever. But if I have 60-year-olds that are still working as real estate agents, they're wanting to be sharp, they're wanting to feel good,
Yeah.
then we stay on them as long as we can.
So just those words, as long as we can. Who's to say? I mean, so when I first looked into this a couple of years ago, they were like, okay, you have to take them within 3 or 5 years of your period stopping, and you can be on them for 5 years. And I'm like, well, that sucks. 5 years. Like, so then what? Like then I get to turn into a hairy old troll. Like,
Ag.
kind of. So it's like, what does that mean? Like, what is it? What do you mean you're gonna
Yeah.
take? Like, it's like flowers for Algernon. It's like you get a brain for a year, and then we're gonna take it away. And so I
Yeah.
don't really understand. So, and you just said that, like you just said, like, and then until you, as long as you can. What's that mean?
Yeah, so there's really like five major reasons why women, like medical reasons why women need to get off hormones. And the big ones are breast cancer,
Hmm.
uh, other estrogen or progesterone, positive cancers.
When you say
Uh,
breast cancer, does that meaning if you get breast cancer?
if you get breast cancer, and I'm talking about like hormone specific breast cancer, which is the most common cause of breast cancer in North America.
Okay.
Uh, if you actively have a heart attack, a blood clot to your lungs, or a stroke. So there's really five big reasons why we would say time to come off. And
Yeah,
even then, I usually have a little time to kind of wean that
I would
down. I don't
think.
have to
Yeah.
usually, cut it off right away. Obviously, if you have a diagnosis of breast cancer, we want to get you off it as fast as we can. But if you're on blood thinners for a blood clot, I can start to kind of wean that down slowly. And then there's other things that we can do for hot flashes and such too, because 50% of women will rebound when we stop it. So they'll have more symptoms again when we
Right.
stop because we stop it. So those are really the only major reasons we get off it, except like, if you have a family history of something that you're worried about, then we talk
Right.
about that. But otherwise, you can stay on them.
Let's say you don't have really, as far as you're concerned, life altering, other than, well, we'll talk about this in a minute. I don't think anybody can say they don't have vaginal dryness or like that sex is impossible without something because I've not heard anybody say that that's just it's like you have people who gain weight, you have people who lose hair, you have people who have hot flashes, and that's all random. I'm not under the impression that the vaginal thing is an option. Like that's just, do you know what I mean? Is that
Yeah,
everybody kind of gets that?
a lot of the symptoms of menopause will kind of eventually subside. The hot flashes, the
Oh,
mood swings, that'll kind of eventually, with time,
that's
kind of
good.
go away on their own. For the vaginal dryness, which tends to get worse and worse as we age. And
Yay!
I know, yay, us. We're so, and there's, we lose estrogen. There's no collagen in the vagina. So, she doesn't stretch and she can't accommodate things that she used to accommodate. And so it burns, like it hurts when you walk because you're rubbing against each other. And so a lot of times women will continue vaginal estrogen because it's not systemically absorbed. They'll continue that even through, I have women in nursing homes that are still on that because
Hmm.
one of the worst things is recurrent urinary tract infections. Dry
Oh,
vagina sucks, but urinary tract infections as we get very elderly can be, I mean, devastating and can
oh,
kill someone quickly.
oh.
So I have women that stay on that forever. There's like, just keep loading it up there. And I'm like, well, we'll do it. As long as
Like
you
a
can still
daily
get there.
suppository type
It's
thing, or
it's a 3 times a week. There's a cream, there's a suppository that's twice a week. There's just different kind of options.
and is that
Um,
good for I mean, is that good for people who are looking for, they don't want to be on HRT or they don't feel they need it and they have, well, actually, I'll just stick to that. And then, but it allows them to have intercourse without pain.
yeah, I think painful intercourse is a big one. I mean, like, because it just hurts. It's just not the
Yeah.
same. And women, what they'll do is we'll say that hurts. Now my libido is low because we're not stupid. We're not going to go back and like, let me do that again. Let me touch this hot stove over and over. We're like, it hurts. I don't want to do it. And so women will say, I have low libido. Well, no, you don't. You have a dry vagina and it's caused trauma,
Yeah.
emotional trauma from it. So a lot of times if we can fix the vaginal dryness, women are very happy to have a great sex life.
Yeah.
Um, and even women that aren't sexually active, I still say use it somehow because it just kind of keeps her active and the muscles good and everything like that too. So there's a lot of reasons to use vaginal estrogen. There's also a vaginal DHEA cream on the market that's called Interosa, which sounds like the Ponderosa Steakhouse to me, but that's just me dating myself. But it's also like if women don't want to take estrogen, they can take this DHEA
A
prescribed as
E
well.
A. What's that? What is it like a suppository or is it like a
Yeah, it's a suppository and it's DHEA is made by the adrenals and it's kind of a precursor hormone to a lot of our hormones. So it makes pregnenolone and then pregnenolone goes out and makes testosterone and it makes estrogen. And so it kind of is this whole thing and it all takes cholesterol to do that. And so it's interesting because DHEA doesn't work if you take it orally. It really doesn't change anything for your hormones internally, but for some reason it works in the vagina. So
how'd they
they,
figure that out?
yeah,
Really? How'd they figure
woman, some woman probably said, we gotta fix this shit. Like this is not okay.
Yeah.
And so I don't use it for everyone because I think that vaginal estrogen is a little bit easier to use. It's 3 times a week, twice a week, but
Hmm.
the interval says every day. So I think women are tired of shoving stuff up their vaginas every day. But it works great. I mean, I used to say if I went to a desert island, one of the 5 drugs I would take would be vaginal estrogen because it works that well. Like it rejuvenates. It looks like a 20-year-old vagina again. Now, why can't I put that on my face and my boobs and everything else? I don't know, but
Great.
but it does really, really work locally. I can see women that have been completely dry. It's smooth. It's not stretchy. It's pale, and like 6 weeks later, it looks like a happy, happy playground again. So it
See, and
does
that's the
work.
thing, like you're listening to an OBGYN, so she actually knows what a healthy vajayjay looks like. And or I guess I better be proper and call it a vagina. Because they aren't
But
we supposed to use the proper terms? Remember,
I don't I don't use proper terms for anything.
I like I
Things
like nicknames.
I call it a cuckoo cachoo or a hoo hoo, whatever we want to call it. I'll just go with whatever she says.
Spicy
Um,
taco.
right. Spice. Oh yeah. Taco Tuesday is a big thing here in Texas. So I say that means something different in my office. Um, but the vagina should look kind of like the inside of your mouth right
Oh,
here.
that's
It's,
a good point.
it's,
Hmm.
yeah, it's pink. It's moist. I can stretch it.
Yeah.
And then it look like the outside of our face. Like it's real thin. It's pale. So I say like it gets skinny smooth, non-wrinkly, which is what I want my skin to be at menopause.
Right.
No, that's wrinkly and not and my vagina now is dry and skinny and not
That's so funny. It's like the
so
opposite.
fucked up. So fucked up.
Like, what do you do? Um, I think so. Okay, so I think that is a good. I just it's one of those things that if people aren't, not everybody's doctor brings that stuff up. I think I don't remember if I had to bring I don't remember anything, but I don't remember if I had to bring that up or not. I think by now somebody would have said something to me, but I do think the HRT and the um not sex drive so much as like the vaginal dryness and whatnot. It's you don't know what it is until you until you know what it is. And I think it's not something you have to have. And it's not something you have to suffer through. And you don't have to be on HRT to not have vaginal, well, you know what I mean, to have vaginal dryness. I don't know if I got that circle right. Um, but so what I think is also a marvel is that you said that I'm just looking at my notes, is that hot flashes and brain fog and what's the other one? And sleep. I don't know if sleep is a thing that ends up coming back, but um the hot flashes and brain fog are sort of like when we were pregnant, if you were pregnant, I do remember the brain getting a little foggy.
Uh-huh.
And then they're like, don't worry, it'll come back. And it did. Um, and I do hear friends that are actually worried about their brains. Like they're really worried that this is a permanent fixture. What do you tell people with that?
So, one of the big things is everything kind of, and I'll liken this to pregnancy. So you have brain fog and you kind of say things you shouldn't when you're pregnant. You think you look really cute and you're pregnant, so you get to say whatever you want to people because you lose your filter.
I don't
Um,
remember that.
because she got a baby in there. Isn't that sweet? Oh, we don't mind that she's a bitch. But then when you're older, they're like, who's that bitchy old lady, right? And
Yeah,
so
no hall pass.
no, there's no grace anymore. So you just have to be real cute
No
about
great.
it. But yeah, I mean, your brain fog on doesn't leave the moment the baby squishes out of there, like because then you're not sleeping, right? So you're not sleeping for maybe 2, 3, 4,
Years.
18 years. And so when you're not sleeping, there's no way for your brain to recover. And so a lot of it all comes from the
Oh,
lack of sleeping. So everything I say dominoes from the sleeping. If you can sleep through the night, you can think better the next day. You
true.
have more concentration,
Yeah.
your weight is better, and a lot of times your hot flashes are better too because your
Wow.
body's covered, it's kind of rested. And so a lot of times we can fix the sleep, everything kind of gets better
Wow.
downhill.
Hmm.
So we used to say menopausal symptoms. This was not part of my generation. This was the generation above me. They would say, "Oh, it lasts for 1 or 2 years. You'll be fine. Just put up with it." And now the new studies show that for a lot of women, menopausal symptoms like hot flashes can last for 10 plus years.
Yeah. Oh,
Especially
great.
women of color tend to have worse menopausal hot flash symptoms.
Hmm.
With Asian women being the least number, usually it's 3 to 4 years. But again, this is just like, an
Yeah.
overarching, it's not every woman's a little bit different.
Yeah.
So now we're like, shit, we were wrong. We're like, they lied to you 1 or 2 years. No, girl, 10. Let's try 10 years. And
Yeah.
so I'm like, why suffer for 10 years if we don't have to?
10 years, that just so I understand, 10 years from perimenopause or 10 years
Your
from,
final menstrual period. So we call it the FMP, the final menstrual period. So they
okay.
can last that long and longer for some women. Um, white women are kind of right in the middle of that, and Hispanic women are kind of lumped in with white women. So it's kind of like this kind of arc like this.
Mhm.
And so I always say, women of color kind of get the raw end of the deal again because they're like, great, and they generally a lot of African American women don't have as much access to care, or they may
Yeah.
have other medical conditions. So it really is it's a damper on their menopausal journey. White women tend to have more things like the brain fog and the joint pain and that kind of thing, but just as many of us can have the hot flashes. So it just
Oh,
kind of depends on the group.
let's talk about sleep for a second and then about alcohol and sugar. I have found that if I eat sugar, I will get a hot flash. which is so annoying. Um, Alcohol kind of goes without saying. I mean, and it obviously both are like massive sleep screwer uppers. And but it's just funny, like if I now have dessert of any kind at a dinner, even if it's not chocolate, there's no sleep that night. Like not, yeah, or I'll fall asleep and then I'll wake up and I'll be up for hours. And is tell me what you think about all that.
A lot of women, so I mean, I'll say alcohol first is, also has a lot of sugar in it, but
It does.
also, alcohol, and of course, a lot of us got through our 40s by drinking alcohol and wine and hanging out with our girlfriends and like
So
this kind
true.
of it's
It's so fun.
delightful, and
Yeah.
Napa wine tours. Napa wine tours aren't marketed to women in menopause because everyone's like, yeah, I'm over that, right? Like that's kind of had its ship. I just literally stopped drinking at menopause because I was just like, first of all, it would take me 2 or 3 days to recover. I mean, we're
Yeah.
talking like 1 or 2 glasses of wine. We're not talking like a bottle or like a
Right.
box like back in your 20s.
Right.
I was like, it would take me days. It was not good for my weight. It
Right.
was, I just felt like crap the next, and I couldn't sleep and I would get hot flashes. So I just finally said, I'm done with this. Like, it's also saving me money by not being on it. So,
But do you find
so
that it was were certain types of alcohol worse for you, or did you find what about sugar in relation to that? Like, you can't
yeah.
the bag
So
of gummy worms, like
the sugar, so and hard liquor is still, I mean, hard liquor generally has less sugar content than wine and beer, less carby stuff. So, but I found even with hard liquor, I mean, the problem is we don't just drink straight vodka. I mean,
right.
most of us don't. We mix it with, a screwdriver or a margarita. Like, of course, in Texas, margaritas, and I would go for margarita, and my heart would be like racing, and I was like, it was just too much sugar.
Yeah.
And so it doesn't really always affect my sleep, but it definitely, I mean, it raises cortisol levels, and cortisol levels cause fight or flight. And then you're like, and then, you're just, your body, once again, is very delicate right now in terms of its homeostasis and how even
Mhm.
it's keeping itself. So if you throw it off the right things for you, then yeah, it'll just kind of mess everything up, and it'll mess it up for a while. It won't just do it like, back in the old days where it was like, 12 hours and you're like, I'm back. It's like
Yeah.
2 or 3 days, for
Yeah, I did
like
notice
the next.
that. Not that I have that issue, but
Yes,
yeah,
yes,
I
I
go
know.
in and out of the. I'm like, I'll go for a month or two for nothing, and then I'll be like, well, I kind of miss the taste of that, and
Yeah.
then I realized why it was that I stopped drinking in the first place. But it's
Yes, and I think it's fine to have drinks. I don't think it's bad. I think that women just need to realize like it's just a little bit different recovery.
Mhm.
Uh, it dehydrates you a little bit more, and then alcohol-based sleep is never, I mean, even in college students, it was
Yeah,
never as quality as not doing that. So now my husband and I we get these cans of this magnesium like club soda stuff on Amazon, and we
yeah,
pour it's our mocktail, and we're like, oh yes, because we got these glasses, we got to use our beautiful glasses. I'm like,
so
let's
funny.
so we're like old people with our magnesium like drinks, like, because magnesium does help with sleep.
What is the
And so
magnesium drink? What is it? What is this
so
stuff? What is this
there's like stuff
tactical
out
thing?
there, but yeah, this is a drink that we get, and I don't own stock in the company, so I don't get anything, but it's called Recess. And uh
Recess, or like
Recess, like
like
let's go play at recess. Yeah, it's called Recess. And magnesium glycinate, specifically glycinate, is the magnesium that helps with sleep. So it also has like some adrenal adaptogens and these kind of things, and there's also to reduce stress and all that. And I think also, it's kind of like, the old women smoked. People
ah,
smoked, and they smoked not because, I mean, not always because of the nicotine, but because also it was a social thing. And you went out
right.
and you inhale and then you exhale. It's like yoga. You do yogic breathing when you smoke a cigarette. And I swear that's part of the reason that women like to smoke is they would go out and they would inhale slowly and they would look around and they were like, so I think the same thing with like these drinks.
Yeah,
It just the act of holding a drink in this
right,
beautiful cup, and I knew what the word was. Um, or just the act of sitting around and having a beverage is
right.
also just relaxing.
Yeah.
Besides just the alcohol in it.
It's true. We get some of the non-alcoholic beers, but now I don't really like all the fizziness out of the blue.
Yes.
You just can't win. Let me look at and see what other questions I had. I don't know. Oh, I know what we should talk about. Oh, kind of a double whammy here. You were probably the one telling me about estrogen and its effects on the heart, and that for women, women are so worried about breast cancer, but the reality is they should be a lot more worried about heart disease. Um, because without estrogen, the heart is losing its protector, I guess, something like that.
Yeah.
And then,
Yeah.
and then also how that relates to weight gain, and is that also part of the heart issue? Um, what is with the that's it's all sort of HRT related a bit, but who knew that heart disease was actually a bigger issue for women than breast cancer in some ways?
Yeah, it's interesting. I have a good friend who's a female cardiologist, and she always said, she's women are so afraid of breast cancer when, and it's scary. She said, but two-thirds, the top three causes of death in this country, heart disease kills more than the other top four. Like that kills more than cancer, it kills more than, I mean, than like everything. Like we're
God.
all two-thirds of us are going to die of heart disease, either a heart attack or a stroke, something in
Huh.
that cardio metabolic family. But we know that estrogen helps the vessels be stretchy and happy. And so as
Mhm.
we start to lose that, the vessels can become more stiff, which is similar to what men have. Also, it changes our cholesterol levels, so we can have a little bit higher
Oh,
cholesterol. And then we notice that women start to rapidly develop hypertension or high blood pressure as we get older. And so hypertension is a risk factor for heart disease as well. And so even the most common cause of death in breast cancer patients is heart disease. It's still not dying of breast cancer, it's dying of heart disease. So I really encourage women at menopause to go just get a baseline cardiac evaluation. I did this
okay.
at
That's a
I just
really good point.
gifted myself at 50, and I remember telling her, I go, oh my God, what if I have a problem? And she goes, then we'll fix it. And I go, I like you. She was so calm. And so I went and I did a calcium score, like a CT, and I just got my baseline calcium results. And it was a little scary, like, because you're like, oh my God, what if I have heart disease? You don't think about it when you're 30 or 40 or even 45, but I was like, I gotta make sure my heart's good. And
Yeah.
so I always encourage women to kind of gift that to themselves, go get checked out and make sure you're okay. Um, and then, make sure you're doing all the things for your heart. The heart's a muscle, so it's very much like your biceps. You can make it stronger, you can make it better, like the bionic woman, you can be stronger.
Yeah.
And so I say, that's why we say to work out. Now, working out at midlife does not change your weight like it did back in your
Right.
20s,
Right.
but it does help your heart and your mental health. And so that's why we
Yeah.
say, walking and cardio will help those things. But
Mhm.
with weight, it won't always help the weight, but like a jazzercise class back in the 80s, but it will help with the other things. So the heart's a big one.
That is interesting. And what I'm actually going to ask if you to do is for women who haven't kind of clued into all this stuff. And I'm actually going to check and see what baselines I've gotten. Um, what you should go to your doctor with, like a list of like, and maybe it's only three things, but like I need a baseline of, what you just said, which was the no, that's not it. The baseline cardiac, the calcium score, like there's like a list of things that, you know, around, I mean, at my age, I probably should have already gotten them done, but and then like ask your parents, ask your mom about where they are. I mean, I know my mom has some heart stuff, so nothing bad. I'm just saying, but it's something to be aware of, and how to treat it, and how to go to your doctor and ask for baselines and stuff like that.
Yeah, I mean, I think, cardiac workup,
Mhm.
certainly a colonoscopy, right? Because colorectal
Right.
cancer is the number one, getter of women. Um, there's so GI, so gastroenterology. I'll say it's in multiple different ways in case people don't know what they're called, but a
Right.
heart doctor, a gut doctor. I think a dermatologist should be every woman's best friend at midlife, and getting your moles checked because that
Right.
changes leaving our skin makes it more sensitive to getting basal cell and squamous cell carcinoma. So doing
Oh,
that. And what I do for women and I tell them is plan all of this starting January. which is when
Right.
your insurance probably resets,
Right.
January of the year, and do all your workups in 1 year and
Yeah.
start early. Like I schedule everything in January because most doctors' offices are not busy in January
Right.
because schools
True.
end in December. So I say schedule them all, call now, schedule them all, get like
Right.
January 15th, 20th, get whatever you need to get and start it up so it's all in one deductible year. Which sounds like kind of old and sad that we're talking about deductibles, but that's what we got to do. And so,
Yeah.
because some of this should be covered by insurance, some of it won't be covered by insurance. And so I say
Um,
just it'll go towards deductible and things, but
oh, okay.
um, just plan it out for like a month. Like I usually use birth months for people because it's easy to remember when you had your last mammogram, when you had your
Right.
last pap smear, all those things. But yeah, I say schedule it all early in the year, get it all through
Yeah.
deductibles, and then you don't have to always do that every year. You just want to do it every so many years.
Yeah, and I do think it's when I can't remember how old I was in the past. It was like 10 years ago or more, and my mom, who's is only like 23 years older than I am, was like, yeah, after 50, it's all maintenance. Like, and it's like your teeth, your hair, your skin, your body, your heart, you name it, your mental health. It's just no one's going to do it for you. You have to do it for you. Like, it's not like us with our kids where we're like, wait, have you had your teeth done, looked at, and
Yep.
cleaned? No, that you're the person that's going to have to do that. And if you don't do it, and um, going from there, though, what about women who are struggling with weight gain? And I mean, I think one of the things about menopause and like looking in the mirror is that for some women, being so utterly different is really mentally hard. And like the weight gain or like we were talking before we went on about, I was like, I'm sort of tired of my face like dropping and dropping and dropping. It's like the only way to fix it is like really a big deal. And you just have to kind of make peace with like the way you look in a young person's eyes walking by you on the street is not the way you looked 20 years ago. Like you just and it's not gonna change. And you kind of need to like, I mean, it's like anything, like you can maintain yourself as best as you can, but you're never gonna be that young person. And mentally, it's probably a good idea to get comfortable with that idea. Like, you know,
Yeah, I am. So weight gains, 95% of women gain weight at menopause.
yeah.
And I would say they probably just can't find the other 5%. They're probably in the pantry eating like Oreo, something like with the lights off. Because almost everyone, I mean, I've never met, I go, the day I meet someone that's like, I'm happy with my weight at menopause, I'm going to shut my computer, say I met a unicorn, I'm walking out the door. I'm never working again.
My
Because
work is done.
everyone, I mean, even if you were normally kind of thin your whole life,
Yeah.
it changes at menopause. It tends to kind of go more to the belly.
Hmm.
Um,
Yeah.
so what I'll see is women will say, well, I try everything. And I'm like, well, there's our first problem is we're trying too much. And so there's diets out there. And what I'll see is women will try one thing and then they're like, it's not working. So they'll go to the next thing, the next thing.
Right.
And it really comes down to consistency. The other thing is we lose muscle very rapidly after 40. So we lose like 3% of our muscle every decade, which doesn't sound like a lot, but muscle is what burns fat faster. And so I tell women, don't worry about weight and cardio. It's not going to move the needle, but worry about weight and like heavy weight. So like not CrossFit, I'm talking like weights, like
Hmm.
really work those muscles because the more
Wow.
muscle you have, the more fat you burn. And so we also, talk about dietary changes, but I'll see women that will eat like practically nothing. So you want to make sure you're getting enough food every
Yeah.
day. And then, try to avoid like the weekend binges, which is what we could do again at 30,
Oh
maybe
yeah.
even 40. But we don't want to do that anymore. But I advise women, especially in Gen Xers in our group, to try and stay away from fad diets because, like a friend of mine operates a diet. She's actually well-known menopause expert. And I joke behind her back and now here that I'm like, oh yeah, she recommends the breatharian diet. Like all you can eat is air. And it has to be like alkaline air from like the full moon. It's all these
Oh my
things.
God.
I'm like, so now we're all just fucking unhappy because we're now not getting any
We're
food and we're like,
angry. That's
this
why
is
we're so angry. We're not
yeah,
fed.
you're watching your husband shove down cheese enchiladas and a margarita, and you're like, I'm gonna have one bean, and you're like cutting it, and this it's bullshit. As Gen Xers, we've been told what, when, where, why, how to eat since we were born.
Yeah.
And I was on my first diet probably at 11 or 12. Did I need to be? No. But I watched my mom do
Oh,
it. I watched someone else do it. And it was the tab and popcorn diet. Why the hell I
what?
thought at 12? Yeah, you drank tab and
Oh my
you
God.
ate popcorn.
You're
Two
lucky
zero.
to be alive.
Well, I quickly got off of that and went to the next one. Like it was a friend of mine, we actually counted up, we did like 140 diets from the two of us
Oh my
a
God.
year. And some of them were the same and some of them were really odd. But
Yeah.
I say, stop dieting. Like, just
Yeah.
stop dieting. It usually doesn't change much. Whether you eat kind of what you want, you may be 5 pounds heavier, but you're going to be a lot happier.
A lot
Um,
happier. No,
or
I'm
you
not a
starve
big diet.
yourself.
I'm not a
Yeah.
diet person. I
So, Mediterranean diet, we say, is the great diet. It's good for your heart. It's good for your
yeah.
bones, good for everything. Like, or the DASH diet is another big one. DASH, it's oh my God, here's my menopausal brain. Dietary something to stop hypertension. It was a hypertension
Oh,
diet at Harvard. And it's actually very reasonable, very easy to do. You can eat out on it. Like those kind of things are good. But yeah, the weight gain is a thing. The other thing I tell women is when we look at ourselves in the mirror and we don't see that young, youthful thing anymore
mhm.
is I always say we need to recalibrate who we're
Yeah.
looking at as our idols.
Yeah.
It's not a Kardashian. I
Mm.
mean, it never was for me, but it's not these, Gigi Hadid, great. Someday Gigi Hadid's gonna be old. I look at the women really, really far above me. So Maggie Smith just died a few weeks
No.
ago. That was a big one for me. I just thought she was amazing. Betty White was another
Oh,
one.
Betty White was one of my
I mean,
favorite.
she looked beautiful, but she was also 95 years old. But part of her beauty was this kind of sassy
So
older
funny.
lady. She was dirty. She was dirty.
30.
Michelle Yeoh just won her first Oscar at 64. Angela
Maybe
Bassett, Jane Fonda. I mean, some of these people have had work done, some of them haven't.
a
But
little.
look at those women ahead. What they all kind of have in common is
Yeah,
they're feisty and they're loving life.
it's
And
true.
so that shows through no matter if the face is doing this or the face is way up here.
Yeah.
And when I look at women, I'm like, what's sexy to me now at 50, 53, actually, is different than what I thought at 20. It's not about the high boobs. I mean, a bra can lift these guys up, or the like
Dead
butt.
across your boobs.
I'm like, I don't care if I have stretch. I mean, it's the activity behind it, which is why a lot of young men find menopausal women really attractive because we know who we are. They're like, oh, I can't knock her up, right? Like there's a lot of really good things and sexy things about being midlife.
Yeah.
We just have to recalibrate who we're looking at. Don't look at Cosmo, which
No.
I don't think it says, but look at the women above you. Julie Andrews is still working. She's like
Yeah.
90. Who was it just turned 90 recently? Sophia Loren and Bridget Bardot both turned 90. And they're
No
like,
way.
Collins, look up Joan Collins. She's 93 and she's got the legs of like a 30-year-old.
I
And
mean,
she's got a
it's
young
genetic
boyfriend.
too. But yeah, oh, good Lord.
Yeah,
Well,
yeah,
she's on estrogen.
yeah, she's on good shit too. But like, that's why I say we don't have to like, just because this is doing this, like,
Yeah.
and we both talked about wanting to fix our necks and this stuff someday. But like really at the end of it, are we gonna do it? Probably not. We're probably just talking about it, but
You talk about it, you like look into it, you're like, whatever. I will say, and I just to circle back because the name of your business is Menopause Rocks. And
Mhm.
I we haven't really talked a ton about it, but I think you get the gist that you are basically a menopause consultant and oh my gosh, we're already into we only have 10 minutes left. Again, I swear they're cheap. They're cheaping me out on Zoom. But
I
anyway,
know.
but basically, oh my God, this guy's here. And I told him not to be here. I can't. Anyway, um, anyway, um, oh, there, what was I saying? But basically, this is a really exciting period of time. And I think one of the things about people, and I know not everybody that reads my blog has kids, but maybe if they're around our age that they are retiring or they're switching their lives up, there's a real freedom mentally to allow yourself to think about just about anything because you basically don't have to think about all those things you used to have to think about,
Yeah.
and whether it's we have to look our best. We're not going to look like a 25-year-old anymore. Um, we have to go to work maybe, but we don't necessarily have to do that job that we were doing. There's another job, and maybe you've been saving and you can actually pursue something that you're super passionate about. It's just, I think it's like I think it's like it's your next adulthood, really. I mean, instead of being born and wasting that first 25 years figuring out stuff, you can actually start on the run as an adult, so long as you manage yourself. Like, it's all,
Yeah.
does that make sense? It's like
Yeah.
a second
Well,
adulthood.
and I call it the halftime show.
Oh, I
Um,
like that.
because like, the good stuff comes up later. Like everyone stops to watch the halftime show, no matter who's performing every year at the Super Bowl. We all stop to watch who's going to be performing.
Yeah.
And I do think menopause rocks. And I know some people like someone one time she goes, "You misspelled sucks." And I said, "Okay, well, you obviously don't get it." Like Stevie Nicks was just on SNL a couple weeks ago, and she's in her
Yeah.
late 70s. Pat Benatar still performs. Ann Wilson just got diagnosed with cancer, but she's still performing. I mean, it's that rock and roll vibe of this isn't over yet. And I love the Gen X thing. I think it's just I'm a Gen X junkie. And that's how I got through puberty, was sitting there with a hairbrush singing to Wham in the mirror when I was
Oh,
having
wham.
a day, or Duran Duran or whatever
Right.
it was. And so I'm like, why can't we use this time to also have rock and roll get us through it?
Yeah.
Whether you're putting on Tracy Chapman or, whoever is your jam, like that's what we kind of have to do to kind of, emote through this time of life. We stuff it down as women because we're adults and we have to, we have a mortgage and, very unfun
Yeah.
things. But if we grab some of that youthful vigor that we had then, like it can be a completely different time.
I, I, look, I mean, there's a bunch of us around that are sort of like, everyone's like, oh, you're so sad and lonely. Like, they've all moved out. And then my husband and I are having a blast. And we're trying to figure out how to utilize this time. And we've been a little ping-pongy, like kid, mom, dad, parents, like, whatever. So we need to like simmer down the schedule to fully take advantage of it. But there is this freedom, and it is I feel sad for people. I see that all the time, menopause sucks, whatever. And this is where I circle back to, they are not taking care of themselves. Um, a lot of this stuff is very manageable, whether it be SSRI or whether it be, um, like, it doesn't take a lot to make a big improvement in your peri to postmenopausal time, but it takes you to do it. So that is a big flag when someone's miserable right now. Because frankly, it's such a, like, I'm looking out at this wonderful blue sky. It's like such a blue sky time. If you're healthy, if your kids are happy, if your parents are doing all right, or if they're not, you're still managing that anyway. But there's just so much possibility, because not the expectations are different now. I'm not saying they're worse or lower, they're just different.
Yeah. And, I look at the men in our age group. So Jeff Bezos, no one's telling him he's old and sad.
Yeah.
No one told that to Steve Jobs. No
No,
one told that to, I mean, like the men are killing, they're at their prime, right? So
they're in
like
their prime.
this is
Why
our
is it
prime.
women are, I mean, always you hear that. He's in his
Who
prime,
told
he's
us
in his
that 50s?
50s.
Yeah, who told us 50s were old? Some culture that said this women are old because we're no longer bleeding and breeding. And but now like you're equivalent in terms of success to a man at this age
Yeah.
for the first time. You don't have to worry about getting knocked up. You don't have to worry about having a period in the middle of whatever. Like you don't have to worry about any of that. So
Yeah.
you really just let your freak flag fly and go for it. And that's what I think is so great about it. And like I said, that's why I look at these women ahead of things, like Betty White. I lean hard because I loved her, and she lived to what 99 and 11/12 or something like that. And the Queen worked until 2 days before her death. Like I mean,
What a
these women,
stud.
yeah, these women are not just like sitting by and saying, "I'll just get a fan and sit on the front porch and make some lemonade." They're like,
Right.
"Nope, not me." And
And
that's what I think we have to look at.
I agree, and I do think there's the sassy factor makes up for any of the bagification of our faces and whatnot.
Yeah.
Um, but this is amazing, and I think what I'm going to do is I'll 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 ask you for some of the lists of ideas and medications and things. I wrote some of it down, but I didn't want to be writing the whole time. So um, for the readers, for the interview, and happy Menopause Day. I
Yes.
can't believe that. By the time this comes out, it will not be Menopause Day any longer, but
I know, but still,
every day is Menopause Day.
the vibe is there. And I have the checklist that I can share with
Oh,
you if you want
great.
to.
Yeah.
That's what I hand to women.
Yeah.
Because it does break it down by body part. So like,
Oh,
cognitive, brain, bone, all the different things. So I can
yeah.
send that so you can share it with your readers if you want to too.
Yeah.
Um, but yeah, it's if we're lucky enough to live long enough, we will go through menopause.
Exactly. Exactly. I actually said something like that. I was playing tennis, and I know I'm half as strong as I used to be. I can just tell. I don't and she wasn't really. And I can't really see on the tennis court anymore. So I'm literally wearing these inside. I look, I look an idiot. And because I'm in that in between, I'm like, I've got some glasses, but I forgot them. So I only had we're at this funny, in 5 years, I'll have it down. I'll be much more aware of what I need, when I need it, and where it will be when I need it.
Yeah.
But I could tell she's in her 20s. And I was like, if you're lucky, someday you'll be where I am and you'll realize, like, no, really, because I said something like, I'm not as strong as I used to be. She's like, oh, no, you're fine. I'm like, no, really. I wanted to like strangle her after a little while. I'm like, no, actually, I'm not as strong. And I was like, and neither will you be if you're lucky enough to get to this point. It's
Yeah.
just
You're like,
the way it
I'm
goes.
not fishing for compliments
I
here. I'm
know.
telling you,
You
sister,
look
this is
great. I'm
coming
like,
to you.
that's thanks, but that it's really about
Yeah.
like when you're, this woman was probably 28 or something like that. And I'm like, no, I never would have understood it either. And I don't look like I'm not, for me, menopause isn't weight gain. It's got other repercussions yet.
Yeah.
Um, and that's a yet because I know these things come and go and whatever. But strength, that is a definite. I'm a weakling compared to what I was 10 years ago, for sure.
Maybe physically, but not mentally.
Not mentally. I'm a mental
Mhm.
giant now.
Right. That's right. You're so mental giant, you can't even be bothered to know the words of this. You're thinking about bigger things.
I love that. Okay, and let's just finish because they're gonna end this thing on us. Dr. Heather Bartos, thank you so much, and we will meet again because I need
You
you to come
know,
in from and give us the pep talk. It's we can make it okay.
we can make we can make it. And Kim knows I'm about to go get my mammogram today. She knows that's my next thing on my to-do list. It's time for the boop, boop, boop wish. So yay, menopause. Isn't it
Go
great?
team! Happy Mammogram Day. Go
Thanks.
get your
Thanks so much.
mammogram.
Yeah, everyone
And
will get their mammogram.
colonoscopy.
I'm doing it. Everyone else has to do it too.
That's right. That's right. That's right. Thank you so much and have a great one.